Hello, I'm Jamie Callie with RWJBarnabas Health Medical Group. I'm joined today with Dr. David Kung. Dr. Kung serves as Associate Professor, Co-Director of Endovascular Neurosurgery, and Associate Residency Program Director for the Department of Neurosurgery at Robert Wood Johnson University and the RWJBarnabas Health System. Dr. Kung has participated in multiple research projects funded by private foundations, industries, and the National Institute of Health. He's published over 80 articles and 5 book chapters and serves as a peer reviewer in 10 academic journals. He's also affiliated with Cooperman-Barnabas Medical Center, Newark Beth Israel Medical Center, and Robert Wood Johnson University Hospital in New Brunswick. Welcome, Dr. Kung. Thank you for being here. Today we're going to chat a little bit about stroke. As you know, it is Stroke Awareness Month, so it's a great time to get in some details about what stroke is, how we can recognize it, and some new advanced treatments we have. Thank you for joining us, and for anyone who's here with us or who might be watching this recorded, welcome as well. How are you today, Dr. Kung?
Oh, I'm fine. Thank you for the invitation, and thank you for the opportunity.
Of course, I'm very happy you're here with us. I thought we'd get started with a more basic question. What is a stroke?
Well, yeah, there are multiple ways that's defined as stroke. Most people think of a stroke as in what we call ischemic stroke, which means for whatever reason you don't get enough blood to the brain. So that ischemic stroke encompasses in the United States about 88% of all strokes. And there are other forms of stroke, what we call hemorrhagic stroke, which means, in general, it means bleeding in the brain. So that's another form of stroke.
Okay, so stroke is related to blood flow then, essentially.
Yeah.
Whether it's being blocked or you've got, like you said, there's bleeding.
Yes.
Yeah. Okay. And because it's related to the brain, that's where neuroscience, you're a neurologist, that comes in. Okay.
Yep.
Now there's a couple really great warning signs for stroke, some that are really visible, that if you notice them in yourself or others, it's a really great time to take notice and call 911, or if it's happening to yourself, if there's someone, you know, who you can act on your behalf to call 911 for you. There's this really wonderful abbreviation called BFAST, and I was hoping you could tell us what that stands for, and help us recognize those signs of stroke as soon as possible.
Yeah, so BFAST is tailored to for people to recognize ischemic stroke. So, and just go through the acronym. So that's BEFAST, BFAST. B stands for balance. So people in general, ischemic stroke symptoms happens acutely. So it's not it's uncommonly a gradual process. So if there's sudden onset of balance problem, you can't walk properly. So that's B for balance. E for eyes. In this case means visual field deficit. So if you can't see part of the space, or you generally patient feel that they can't see out of one eye, but really it's a visual field deficit. So that's for E, for eyes. F for face, meaning facial asymmetry. People will note that when they look in the mirror, half their face seems to be droopy and the eyelids seems to be uneven. So F for facial asymmetry. A for arms, meaning one arm feels weak or feel numb. And actually that you can extend that to the leg as well. So meaning half the body feels weaker than the other half, or there's numbness on one side of the body. S for speech, usually it can go several ways. It can be incoherent speech. You can keep on talking, but it doesn't make any sense. Or slur speech, that you can't know what you want to say, but you can't say it, or you say it in a very slurred fashion. And lastly, T is for time. Time is critical when you notice symptoms like this, and it's time to call 911. So that's acronym for BFAST. Like I said, for ischemic stroke, that acronym is very good to help us recognize stroke onset. In terms of the 12% of hemorrhagic stroke, it fit a little bit less well with that acronym. And for hemorrhagic stroke, usually patients present with acute headache. Usually severe headache and confusion. That seems to be a more common presentation. And in addition to what we call those focal deficit, like we already explained in the ischemic stroke. So either way, when it comes to stroke, treatment is very time critical. So immediately calling 911, immediately recognizing that you might be having a stroke, and seeking emergency treatment. That's very important.
So, like, just to reiterate a bit of what you were saying, if you notice any of the symptoms that you mentioned in the BFAST abbreviation, rather than taking time to sort of, try to figure out on your own, are you getting better? Is it getting worse? Sort of just act, if you notice, like you said, some of that weakness on your body, any kind of drooping, difficulty speaking, you really should call 911, get to the hospital. And of course, it could be something perhaps other than a stroke, but best to get checked out by the doctors and nurses there and be certain, rather than wait and see if anything improves over, like 30 minutes, an hour or something.
Absolutely. I mean, I think the best thing, once you think you might be having a stroke, the best thing is just call 911 and tell the dispatcher that
you're having these symptoms, you think it might be a stroke.
Yeah.
Okay.
And
excellent.
I mean, from a clinician standpoint, we sometimes encounter kind of sad story that because of our treatment are so time sensitive, wait long enough, you can no longer receive some of those treatment. And we see patients coming in, they tell us the story. Well, oh yeah, I can't know that I was having a stroke, but then they make the mistake. Well, or maybe I'll go take a nap, or maybe I'll go sit down. Maybe I'll get better. Or they try to call the primary care doctor's office, trying to make an appointment. So we hear a lot of that, and it's unfortunate. And that's why we want to do this type of educational seminar to encourage people to call 911. There always seems to be a barrier. People don't want to call 911 as if we are bothering them. No, we want to help, and especially in something like this where every minute really matters. So I think we will rather err on the side of us making a wrong diagnosis than you really having a stroke and not seek emergency treatment.
Better to be cautious than not cautious. Absolutely. And you mentioned, you just touched upon it very briefly, treatment. And I know that there's been some stroke treatment for a while, but there's also been some really great advances recently. I was wondering if you could tell us a little bit about some of the new treatments we have for stroke.
Yeah. I mean, the new treatment, so historically, we have TPA is a very strong, if we're talking about ischemic stroke, which is the highest number of patients. Historically, we have a blood clot dissolving medication called TPA, but that has been around since 1999. The paper was published back then. So it took a long time for people to get used to giving TPA, because initially it was a little bit, people are afraid of the side effect, which is very low percentage you can get hemorrhage. But over the years, we ultimately developed what we call mechanical thrombectomy. The major studies came out in around 2015. And since then, multiple additional studies came out that extended the time range that we can treat patients surgically. for mechanical thrombectomy, we specifically take the patient to the operating room or to the angio suite where we put catheters inside the blood vessel and navigate it up to the brain. And we can remove the blood clot directly. It's a highly effective surgical procedure. But again, the longer you wait, the less chance you'll be suitable for that type of treatment. So, again, going to the hospital is critical. Since 2015, like I said, the time window expanded to some degree, and more recently we're looking more into what we call out of the guideline, out of the study population. So, for example, usually when you do a clinical trial, those patients get selected into the trial are like perfect patients. So because they are perfect patients, then you have a trial that shows positive result. But obviously, once you roll out the treatment to the general population, not everyone's perfect. And we find out that, and to some extent, it's encouraging that even for patients who were sick to begin with, or patient with already severe damage, we're still seeing some benefit out of the procedure. So those are encouraging, but obviously it's critical that we don't misinterpret that as in, oh, I can wait a little bit longer. The sooner you do it, the larger the benefit. And but overall, since the original publication of some of those studies, there are more advanced techniques, and the devices are better, the catheters we use are better, everything's are improving incrementally. So all those allow us to help more patients that could come to us.
And using this surgical technique, do you see better patient outcomes with this?
Yeah, dramatically better. The statistics are really very impressive, very impressive. I mean, it's rare where we have a treatment that's that effective in the right patient. However,
that's promising.
Yeah, the surgical technique really is only applicable to a small percentage of stroke patients. So a lot of them still, they're not candidate. So the best actually is still prevention. If you never have a stroke, then that's probably the best. Then your brain never take a hit. So I mean, I'm a surgeon. We all in the field of acute treatment, but still I think not having to do the procedure is actually better.
Absolutely. Yep, preventative measures are excellent. Now, I know that we've talked a little bit about, what is a stroke, how do you treat it? But if you have a patient that has undergone, had a stroke, undergone some treatment, what are some things we're doing? I know that you're involved with the RWJBarnabas Comprehensive Strokes Center. And that's something, it's really interesting because it follows the patient a little bit further than just you've had your treatment at the hospital and now you're ready to be released. Could you talk a little bit about that?
Yeah, I mean, the Comprehensive Stroke Center involves a lot of people. I mean, it's a giant team of very dedicated practitioners. So surgeon is only a small part of it. There are a lot of stroke neurologists, physical therapists, speech therapists, and at our center we provide 24 hours, 7 days a week, expertise for any form of treatment that's needed. And we are very proud of. We have a post-discharge program that oftentimes patient had a stroke and they're on the road of recovery and getting better. But to navigate through the healthcare system is very confusing and difficult, and they got better things to think about. So we have a program to guide them through the rehab process,
Mm-hmm.
make sure they have the right follow-up, and we see every single patient 1 week after
Mm-hmm.
the discharge, and then we have a scheduled follow-up with them. So I think that is important and is very helpful.
Mm-hmm.
I mean, especially, this kind of American healthcare system sometimes can be kind of fragmented. The moment you leave the hospital, your primary care doctor didn't know what's going on, and
Mm-hmm.
the patient becomes primarily responsible to seek
Mm-hmm.
the follow-up rehab. And sometimes they have to argue with insurance company. So I think our program do help patient navigate that post-acute period of stroke recovery.
Mm-hmm. And it sounds like the Comprehensive Stroke Center, the nice thing about it is that, they've got somebody guiding them through those next, like you said, whatever it might be, whether it's rehabilitation or other forms of appointments. So they get back to their pre-stroke lives, because for some, stroke can have a lot of lingering side effects, I know, as well, physically and whatnot.
Yeah, I mean, the comprehensive stroke really is to, we want to be the best in every single category. So in terms of how fast we move, how fast we mobilize, the treatment when the patient first show up, those are critical factors. I mean, every minute we count them, and we put in a lot of work trying to optimize the workflow to make us go faster and faster. And we, like you said, we already mentioned, we also keep track of all the post-stroke deficit. If there's speech or swallowing difficulty or mobility difficulty, we guide the patient through the process. Yeah, so I mean, it's a huge team effort, and it requires a lot of organization.
And I imagine it improves patient outcome as well.
Oh yeah. I mean, to be able to deliver some of those treatment, there's no question. We definitely improve outcome.
I would imagine too, just from a stress perspective as well, like you mentioned, navigating insurance and getting appointments and stuff like that. After you've had a stroke, probably don't want to have a lot of stress like that on your plane. So alleviating all of that sort of has like this really nice sort of like lifting weight off your shoulders effect, where you know that you're going to come to one space and get all the care that you need.
Yeah, I mean, absolutely. I mean, that fit with our mission. Our mission is to take care of patients. Our mission is not to do the surgery or to give you one medication. Our mission is to take care of the patient. So I think that's part of our work.
I think that's a great note to end on. I mean, I think that patient health is really, like you said, that is the goal and the mission of healthcare. And before we sign off, I want to thank you again for joining us. I want to just reiterate that if you are having noticing any of the signs or symptoms from that BFAST list that we had mentioned, calling 911 and getting to the hospital as soon as possible is, like Dr. Kung mentioned, the most important thing, because time is of the essence. But also knowing that there is a team at RWJBarnabas Health, waiting for you that has your total health in mind. Hopefully that takes some of the stress out of a really important topic. So thank you for joining me for Stroke Awareness Month.
Thank you.
We're going to post this video on our social channels, and that'll include Dr. Kung's information. If you have any questions or you'd like to schedule an appointment, you can reach out to his office. Otherwise, thank you again for joining us. I hope you have a great afternoon.
Thank you, Jamie.
Have a great day.